Bad news if you're a human being that may require healthcare one day, which would be all of us. Turns out health insurance is about to get even more expensive. Mm. According to a report in The Lever, the six largest health insurance companies, who combined made over $1 trillion in revenue and more than $31 billion in net income last year, are now pushing to raise Americans' health insurance premiums by as much as 66% for certain plans in certain states, according to recent state regulatory filings. Of course, proposed increases come as these same companies have been rewarding their shareholders with billions of dollars in stock buybacks and dividends. Yes, shocker. According to data compiled by the Kaiser Family Foundation, the ACA marketplaces across the country are projected to see the largest rate hikes in more than 5 years, driving up out-of-pocket premiums for individual plan policyholders by more than 75% on average. Now, obviously, that's going to have a devastating impact on the more than 24 million Americans who are not fortunate enough to have employer-sponsored health insurance. That's right. Now, look, a lot of people that work in certain industries, at least, have employer-sponsored health insurance, but there are a lot of people that don't. Okay, think of all the people working at Walmart. Those are the people that have to go on Medicaid. In fact, they are told to get on Medicaid. And those people also will likely be seeing a cut in benefits as well. And that's a different conversation, but still disastrous. Now, here's the funny thing about this. These companies are actually blaming Donald Trump. Huh. Now, specifically going after the on-again, off-again tariffs, but mainly the fact that his administration is actually killing federal premium tax credits. These companies say that ending those credits will significantly threaten their ability to remain competitive. I don't think that's entirely true. That will, of course, threaten their bonuses, and it's because they're doing this while denying claims, raising the price of prescription drugs, and of course, raising the out-of-pocket costs for the people on those plans. And again, all while their profits, their shareholders continue to rise. Look, it's going to get to a point where even more people will not be able to afford insurance. Look, currently more than half of those with health insurance point to the fact that at least 10% of their monthly spending goes towards their healthcare alone. Remember, about half of all Americans cannot afford a $400 emergency. And now you're raising the costs for them to go, for their health care. We're being squeezed. We're being squeezed and squeezed and squeezed by these industries while the top earners keep bringing home their massive bonuses. The Lever previously reported that the industry's top earners have actually raked in more than $371 billion in profits since the passage of the ACA, which again, the ACA was a massive corporate giveaway bill. Let me give you some examples. Elevance Health, which operates Anthem Blue Cross Blue Shield, plans across 14 states, has proposed their average premium increase of more than 33% for individuals. They generated over $175 billion in revenue. That's nearly 8% increase from 2023. So far this year, that company has distributed over $1.2 billion to its shareholders through stock buybacks and dividends. The increases for the quarter and year were driven primarily by higher premium yields, the company stated in its recent earnings report. United Healthcare. Oh, yes, that United Healthcare. Their premium rates on the marketplace are also set to rise in some states. For example, in New York, the insurers proposed a rate hike of more than 66% for some policyholders. In Washington, they proposed a 37% rate increase. Meanwhile, United Healthcare's parent company, United Health Group, reported a revenue of more than $400 billion in 2024, 77% of which came from premiums, according to their company's earnings report. United Health Group has spent $9 billion on stock buybacks and $7.5 billion in dividends. That's despite the fact that they apparently had a rough year. Gee, I can't imagine why. Can't imagine what started that year. Maybe something to do with someone named Luigi. Player 2. Okay. Another company, Cigna, which requested a 29% average premium rate increase for individual ACA plans in Colorado, is rebounding after their weak 2024, generating $1.3 billion in profits in the first quarter of 2025, after putting up a $277 million loss at the same time last year. Despite their troubles, Cigna generated $3 billion in profit and spent $7 billion on stock buybacks, along with $1.5 billion on dividends. So there you go. They're buying back their own stocks, which inflates their own stock prices, which rewards shareholders, the people that have those stocks. So there's that. Now, finally, CVS Health, which acquired Aetna in 2018, said that they'll be completely leaving the ACA marketplace. There you go. Approximately 1 million people in 17 states will have to find more coverage. And this has been happening for some time. You've been having these health insurance companies that are leaving the exchanges. And so it leaves a lot of these people who do not have employer-sponsored plans. I mean, they're out of luck. Not going to be able to afford insurance anymore. Look, this is one of the reasons I kept warning about the ACA and why it was never going to work in the first place. It relies too much on corporate giveaways. And when those giveaways disappear, like, for example, Republicans get into power and they take those giveaways away, well, you end up having so many people that are no longer able to afford their health insurance. They'll have to drop their plans and they won't be covered at all. That's the problem. And again, this is all wild. This creates a death spiral in the health insurance markets. Look, they keep having to raise their costs or deny care, which they've been already doing. And yet they're doing all of that while continuing to shower CEOs and shareholders with more and more money in bonuses. And that's it. Obviously, the correct policy would be to provide health care to everyone. For example, a Medicare for all, universal healthcare system. That's the correct policy response. That would eliminate all of this. Get rid of the health insurance companies. They're parasites. Okay, you want to talk about parasites sucking off the system, sucking off the hardware working taxpayer. I know that sounded really bad, but you know what I'm saying. Okay. I didn't mean to go all,
sexual anarchy
on you guys, but they're parasites. They're ticks. They're sucking the blood out of every, person, every taxpayer to help their executives. And that's it. That's why we have to get rid of them. Okay. There are some things that should not be monetized and commodified. And healthcare is one of those things. Unfortunately, what we're stuck with right now, because of Republicans and, yes, Democrats, is a system of wealth care. That obviously the only point of wealth care is to help the richest and most powerful corporations continue to make more and more money. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.